scapulothoracic joint. First point, it is not a true anatomical joint. It is not a true anatomical joint. And second point, it is a functional joint. It is a functional joint. Okay. Next point, the scapula which is present here. Now we are seeing the posterior direction, mean posterior view. So this is the thoracic spine 1 to thoracic spine 7. Here I draw from thoracic spine 1 to 7. So that here the scapula is going to place. It is going to place over the ribs, simply we can say place over the ribs. So this is the connection between the scapula and thorax. Suppose if you see, this is the inferior angle of the thorax, this is the superior angle of the thorax, this is the spine of the scapula. Okay, this is the inferior angle of the scapula, this is the superior angle of the scapula, this is the spine of the scapula. So if you see the superior spine of the scapula, the superior angular spine of the scapula, the superior angle of the scapula will be exactly over the T1 vertebra. Suppose if you see spine of the scapula, it is exactly over the T3 vertebra. If you see inferior, it will be exactly over the T7 vertebra. So that here the placement T1, T3, T7. So spine of the scapula will be at the T3 thoracic vertebra. Inferior it will be over the T7 thoracic vertebra. Superior border or superior point or superior angle, it will be over the T1 thoracic vertebra. So this is the position of the scapula over the thorax. And now we'll see, however the position of the scapula which is we are seeing here, it depends on the clavicle. This depends on the clavicle. What it means, here we are having clavicle, clavicle will be anterior. Okay, anterior, scapula will be posterior. So the clavicle here, it is going to articulate with the, here the spine of the scapula is nothing but the acromion process. The acromion process is going to connect to the clavicle, that is AC joint, acromioclavicular joint. So here acromioclavicular joint, first one. And second one, here the clavicle will go and it will attach to the sternum anterior, that is sternoclavicular joint. Second one, sternoclavicular joint. So the position of the scapula will be indirectly depends on the acromioclavicular joint and sternoclavicular joint. Because of this orientation, here one point is clear. Suppose if the scapula is moving, whatever the movement, either elevation or depression or protraction, retraction, or medial rotation or lateral rotation, whatever the scapula is doing movement, this movement is going to create the movement in the acromioclavicular joint and sternoclavicular joint. So this is what we discussed earlier. The shoulder complex movements are the integrated movements. Integrated means one joint will move, another joint will automatically move. So that's what integration. So here, if the scapulothoracic joint, if the scapula is going to move, if the scapula moves directly, mean it is going to move the acromioclavicular joint and sternoclavicular joint. So this is about the scapulothoracic joint.